Good morning, Bruins. My name is Julie Sina. I am very proud and pleased to be the director of your Alumni Association. And as my background indicates, we have over 500,000 Bruins around the world. We are Bruin strong. And today we're bringing our Bruin community together to talk with several of our alumni about a day in the life and where they are at in terms of being in Shanghai, Hong Kong, and Milan, and what their experience has been and how their life is going now in a way that we're connecting our Bruins together all around the world. And so those are the spots we're starting in today. So what I'd like to do is to invite each of our panelists to introduce themselves, tell us where they're at currently, also what you majored in when you were at UCLA, so we get a sense of what you studied when you were here, and just give us a little bit of background in terms of what's been the journey of your country and where you're at today. Now, I realize that's a lot, but just if you could take maybe 3 or 4 minutes and help us get to know you and where you're at today. So let's start in Milan. Max?
Hello, Julie. Thank you for having me, first of all. And I'd like to thank everybody for connecting and being part of this conversation. So as you said, I'm in Milan. And first, a brief introduction. I graduated in 2012 at UCLA as with a Bachelor's of Science in Physiological Science. And then I moved on to get a master's in Spain. And then eventually I started doing medical school here in my home country. And as of right now, Milan and all of Italy is in a national lockdown. So I'm in self-isolation with my girlfriend and another roommate of mine. And pretty much my day is divided between online classes, which my university is trying to keep them going, make sure that we stick with our plan.
Well, Max, which university are you with now? Where are you studying?
So I'm studying at Humanitas University. It's a medical school connected to one of the largest hospitals in the north of Italy. And it's quite close to Milan, just outside the city. And so I've been there for 5 years. And so because I'm one of the oldest, amongst the older students, we've been asked recently to just go in and give a hand. So I've been spending some time in the hospital helping out, and then online classes and just spending time with the people I'm doing self-isolation with. So that's mainly what my life has been: cooking, playing board games, and then a bit of hospital and online classes.
Oh, thank you. So you're on the front lines in Italy, Max.
Well, I'm a bit cautious as far as saying that I'm on the front lines. There are people who dedicate every day of their life. They're in COVID wards, ICUs. What we do is we help out where we can in very low risk scenarios, and make sure that the people that come into the hospital are as safe as they can be.
Thank you, Max. Max mentioned that he's currently studying. I thought I'd share with you as well that we're in our 3rd week at UCLA of spring quarter. And as Max recalls his time at UCLA, for those of you as you're reflecting on that now as well, this has been a huge transition for us to go to a complete remote learning environment, and a big adjustment for our students and for our faculty. So definitely hear you, Max, when you talk about studying virtually. That's what we're doing here in Westwood. So let's move to Shanghai. Jessica, tell us a little bit about what's going on there and where you're at today.
Hi, everyone. Thank you, Julie, for inviting me. My name is Jessica Liu, and I'm a class of 2012. I actually studied mass actuarial science when I was in UCLA. So after I worked as an actuarial consultant for a couple years in LA, I decided to move back to my hometown, Shanghai. So I have been in Shanghai for about 2 years. So I'm currently working as a project management for an insurance company. So as far as the virus situation, I have to say China is probably one of the earliest country actually had an outbreak. So starting probably right before Chinese New Year, around, I would say, January 23rd, Wuhan went to a full lockdown, and that's when Shanghai actually realized there are some confirmed cases. Luckily, I was actually in LA for the holiday, and I came back in February. Shanghai was still in very strictly managed, but it's not a complete lockdown. I think in China, only Wuhan province was actually in lockdown status. So as of now, I think things are slowly getting back to normal. So I think right now, most people are back to work already. The school are still actually holding virtual classes. but most of the workers are back already. So, and you know, you all see people on the street with masks on, but restaurants are open. There are no public activity yet, but I think things are slowly getting back to normal.
Got it. So moving to Hong Kong, Diana, the last time we saw each other, we were celebrating the centennial together, and there was a lot going on in Hong Kong at that point in time as well. So talk to us a little bit about what's going on and where you're at today.
Actually, we knew that early January, we start to know some cases in Wuhan. And then it's around the New Year time, we know it's become more serious. But because Hong Kong, we have SARS experience. So most of the Hong Kong people, we already wear masks when we go out. And the school also, actually the schools, no school since late January because Chinese New Year. And before we resume school, and then the government already say all class suspension. So, and currently Hong Kong is under control. Like
and what does that mean? What does under control
up to now, all the confirmed cases around only 1,004 around, and then the death rate only 0.4%. So I should say in Hong Kong is pretty safe. I feel that at least compared with the rest of the world. Yeah.
So Jessica was just saying that Shanghai is no longer under lockdown. Is that the same for you? Are you free to go out at this point?
Actually, the government strongly advised we stay home. And I think around a few weeks ago, the government tried to control us to getting together. If more than 4 people is illegal. Yeah.
So Diana,
so they will give you a ticket.
You have a ticket.
Yes.
So Diana, the other question I wanted to follow up with you on is I know that you also have a son. So can you share a little bit about what that experience has been like for you to parent during isolation and perhaps return to maybe doing some teaching?
My son is 7 years old son. So actually he feel very happy now because every day stay home with mommy and daddy. But then because no school, so all the schoolwork rely on Google Classroom. So I need to do the classwork together with him together every day. And also the online lesson is on Zoom. So we will have 3 lessons per week live with the school teacher. And then the rest using Google Classroom to do the schoolwork. Apart from that, I need to keep him busy every day. So for example, my home sometimes will turn into a cinema, and maybe tomorrow my home will become a restaurant for my son. My son also take out the camping tent and put it in the middle of my living room, and he sleep there for a week, like a camping in the house.
So you've also been juggling, have you also been juggling your work at that same time? Have you been juggling your job?
My work, because I'm a full-time mom.
Okay.
Yeah. So I have been a full-time mom for quite a year. So it's actually my main work is take care of my son and also maintain the house. So it's okay for me.
I think that sounds like 2 or 3 full-time jobs, Diana.
Yes. Yes. Like one the clock. Yeah.
So Max, I want to follow up a little bit with you as well. I know you've mentioned that you're in medical school and you're working in the hospitals right now. Could you talk a little bit more about what it feels like and what's going on in the hospitals in Milan?
Sure. So it's been difficult because us students, all of a sudden we were told just to stay home, and going to the hospital, especially for those who are in the later years, going to the hospital was part of our daily life. So it wasn't just an issue of going to university and on campus for classes, but for us going to the hospital and doing our clerkships, it was part of our daily life. So when that got postponed and that got initially suspended, everybody was a bit, that's when we got to feeling like things might get serious, things might get bad, and what do they know that we don't know? Why is this lasting so long? And I think it was hard for students to be far from the hospital and far from campus. So then when we got an email around mid-March from the hospital saying, listen, it's staff is working, double, triple time. It's really hard for us to keep things going in the best way possible. If any student is willing to come and help, they need to have their own car, first of all. So you want to make sure that people did not have to take.
So no public transportation?
Right. So they wanted to make sure that nobody had to take public transportation. And so if you met a couple of criteria, then you could ask and they would let you go and help. So it's been about a month now, maybe 3 weeks. And well, the hospital, it has changed a bit. The hospital has changed a bit. First of all, you walk in, everybody has a mask, which we're used to now, but 3 weeks ago.
Max, could I also ask, I know here, there's also limited access to the hospital. So there's no visitors, there's, so is that pretty much the same for you too?
So what they've done is that, well, if you need to go to the emergency department, so that's a whole different access. Mm-hmm. And you go through the triage. So they check you and they test you before letting you into the emergency department. So this happens in a big tent outside mm-hmm. the hospital, and then you go in, you go to the emergency department, and that whole section is essentially isolated from the rest of the hospital, as are COVID wards that have been entirely dedicated to coronavirus patients, ICUs. So there's whole sections that have been closed off. What I go in through the main entrance, let's say, and there's lines, people go in one at a time, everybody's checked for temperature, everybody has to have a mask. There are several checkpoints throughout the hospital where they'll stop you and they'll make sure that your hands are sanitized. So a lot of things have changed, and they've tried to set it up in such a way that for those who must come to the hospital, mm-hmm. so for example, cancer patients, they still need to get their chemo, they still need to get their, need to do their visits, so just because coronavirus is here, that doesn't mean that all the other people who had illnesses and who were patients before coronavirus, they still need as best of a care as possible. So the hospital is doing what they can to make sure that people are safe, and we just play a small role in this.
Has this impacted your thinking about what kind of medicine you'd like to practice?
Well, partially in the sense that one of the things, so I'll be graduating soon, and I'll be thinking about residency and where I want to continue with my profession. And part of it was also deciding which country possibly to go in and keep going with my residency. And the thing is that the next step, it orients your profession a lot. So unlike other professions where maybe you work for some years in one country and then you move, and then if your expertise allows you to, you can bounce around a bit. That's not really possible in medicine. So when you pick where you want to do your residency, that means a lot. Mm-hmm. And seeing how things have been evolving and the kind of solidarity that is necessary in these times, I have an appreciation for having a public national healthcare system, seeing it work, seeing people taken care of. I guess it has impacted me a lot, and from that point of view, it has made it stronger in my mind to stay in Italy and possibly continue with my profession here.
So I'm gonna come to you in a minute, Jessica, but I want a follow-up question I want to ask you, Diana, real quick. Is can you talk a little bit about, has this impacted the political tensions that have been existing in Hong Kong even back when you and I were together, the pandemic?
Sorry, I don't understand your question.
How the political tensions that have been going on in Hong Kong, has the pandemic impacted that at all, or where's that at now?
You mean the political?
Yeah, the political climate in Hong Kong. Yes.
Yeah.
I remember when we were together, there was a lot
actually, now it's like become better normal. Every time, everyone united. Yeah. So Hong Kong is all the resources and everything. Everyone focus on on the disease more. Yeah.
So that
So
the tensions have really been focused more on dealing with COVID right now. Got it.
I think 100%. Yes.
Thank you,
Yeah.
Diana. So Jessica, when you were talking, one of the things I was reflecting on as I was listening to Diana and Max is that Shanghai seems to have returned, if normal is such a word we can use anymore, moving more along that path. But we've also been reading about how some of the cautious measures that have been going on in Shanghai about the daily temperature checks and scanning codes. Can you speak to, has that been part of your experience?
Yes, actually. We have been using something called house codes ever since probably like the outbreak. So basically, it has to, and every time you enter into those office buildings or mall or some restaurants, they will check it to make sure you have been in Shanghai for the last 14 days. And if you're coming from a problematic area such as the Wuhan province, like Hubei, Wuhan, or right now it's a lot of overseas countries, basically your code will be red. Basically, you will not be allowed to go into those buildings. Mm. And everywhere you go, they definitely check your temperature before you enter the building. Besides
so how does that happen, Jessica? How does kind of walk us through how that happens?
You mean how the code or the temperature, or how the precautions being?
Yeah.
I think ever since the epidemic started in Wuhan and then there are more cases in Shanghai, I think the government has been really working to actively control the situation. So Shanghai was never really fully locked down, but the government strongly suggests us to stay home. And most restaurants are closed, like all this, cinema or like movie theaters are closed, basically. And then I think very soon in February, I think by the time I got back, like mid-February, they already developed this code with Alipay. Basically, Alipay has all your information, and they also working with all the cell phone companies to track where you have been for the last 14 days to make sure you are staying in the city. And ever since then, we have been using the code to get into buildings. And talking about going back to work, I think China actually extended our Chinese New Year holiday for another week, and Shanghai government actually extended for the third week. So we didn't go back to work until probably like mid-February. And in order for you to get back work, the office has to provide masks for the worker to use. And basically also, like I said, I mentioned that you have to have your house code to be green to access all the buildings.
So do you feel like that's changed the way that people interact with one another, all those precautions?
Definitely. Talking about social distancing, right? So basically, we used to, all the, Chinese people like to gather together, have lunch or dinner. Basically, I haven't seen my friends for a long time. We actually have to do virtual meetings now too, to drink and to have fun. When we go back to work, so they provide individual lunch boxes now. So basically, we can't even have lunch with your coworker. We have to set like 1 meter apart, which is about 2/3 feet apart. So
it's difficult to be in the same room with a lot of people.
No more meetings anymore. All virtual meetings for all the companies at this point.
So even when you normal part, you're going back to work, you're still doing a lot of those meetings virtually, even though you're back in the same space.
I think at least our company and the most company I know are trying to avoid all the meetings as possible, or have virtual meetings or phone conference calls. But like I said, like the city are slowly back to normal. I mean, we still check the temperatures every day. Like this morning, I still get check temperature every time I went into my office.
So let me ask, before I go to the questions that are coming in from our audience, as well as the ones that folks sent in advance. My final question for you before we go to that section is, how have each of you stayed positive or found some resilience during this time? Anybody want to start?
I guess I would start. So when I got back to China, Shanghai, I have to do a 14-day quarantine at home by myself. Pretty much I live by myself. So in order for me to stay healthy and not go crazy, I think first of all, have a regular routine. So for my regular routine is exercise a little bit, doing the home exercise, and friend support. Even so you can see your friends virtually, they're just video call, FaceTime. We actually basically talk probably like every 2 or 3 days. Like we even had our drinking together, like at our own home.
Virtual happy hours is what's going on here.
Exactly.
So Jessica,
And
you stay positive by staying connected with your friends, it sounds like.
Exactly. And have a routine, exercise and read.
Right.
One other thing actually was very popular during the quarantine time in China was cooking competition. So that was actually one of the fun things we do. We cook and we share pictures. You will see so many of your friends become like a really good cook, chef. Yes.
And look forward to sharing that food one day. Max, how have you stayed positive or found resilience during this time?
Well, I was listening to Jessica's answer, and there's a lot. It's very similar here in the sense that at some point, Jessica mentioned how they were used to all being together, especially when they went out. A lot of people, these big tables, maybe 15 people at the same table eating together. But again, like that's gone, and realistically, it's going to take a while before people go back to that. Mm-hmm. And it's been hard to transition and just accept the fact that we're not going to go back to what we were used to anytime soon. We'll be going back to normality step by step, and nobody really knows how long that's going to take. But going back to your question, how do we stay positive? I agree as far as having a routine and being somewhat active, not just mentally, not just on your computer, but also if you can try to keep yourself active a bit. I find that really helps for me at least. And then besides that, I think time has really slowed down for some people, not for everyone. Some people have been working, even more compared to what they how much they were working before. Some people are still working in hospitals and emergency services, so their life hasn't really changed much as far as how much work they do. But for a lot of other people, I think time has slowed down a bit, and that opens up possibilities. I tried to learn how to play the guitar. It hasn't been going great, but it's been keeping me productive.
So no concerts for us on this call, huh, Max?
No, I don't think so. I think it'd be best.
I'm going to jump to Diana. Diana, what's a key? What's something that's kept you positive and resilient?
I think first of all, I can tidy up my home finally. I mean deep tidying up. Okay, so I wanted to do it long time ago, but no time. And before we always rush for everything, especially Hong Kong people. So now I try to do everything slowly because a lot of time, kind of like practicing mindfulness on every single thing. Actually it's pretty good. We try to experience everything deeply. And also, like Jessica said, I cook a lot nowadays. So try different things and also involving my son to help me to prepare all the food, and he really enjoying it. And before I think he couldn't do it, and turns out he can do it, and he enjoying it. So
thank you all for sharing that. I'm going to go now we have so many questions coming in from our audience. So audience members, I'm going to do my best to get to as many as possible. So it may feel like a little bit of rapid fire panelists, but a lot of questions out there. So one question is, how do you feel your government's handling the pandemic? How would you rate them? Anybody want to take that?
I will go for Team China. I think China has the most strict policy ever over all this pandemic, probably over other countries. And I have to say it is very effective as of now. I think there are no new cases, domestic new cases. Most cases actually are from overseas at this point. So I have to say 10 out of 10.
Anybody else want to take that one?
Well, I don't know if I'll go for 10, just because there have been some issues as far as communication from the government going back to people, and some confusion. And it was hard for people sometimes to really figure out how to behave. And so maybe something could have been done better in that sense. But overall, if it's not 10, it's close to it. I think it's very hard to find a balance between shutting everything down and keeping businesses open and making sure there wasn't a complete economic meltdown. It's very difficult, and personally, I think the government did a good job in that sense. And again, as I was saying, in conversations I've had previously, there's also a cultural component. It's very hard to keep Italians indoor. the nice weather is coming, spring is coming, and telling Italians, you should stay indoors, don't go to the parks, don't be all together. People are start wanting to go to the beach, can't go to the beach. It's been tough. It's been tough. I think the government.
Here's a follow-up question specifically for you. Someone is wondering if Lombardy, and I'm sorry if I'm pronouncing that wrong, they're saying they have the highest number of cases and wondering if that's impacting you.
Yeah, so the region Milan is in is called Lombardy, and
it was close.
Yeah. No, it's Lombardia in Italian, but Lombardy is close enough. So yeah, we've been hit the hardest. Just briefly, I looked at the dates before we had this talk. So essentially, right up until the 21st of February, we had very few cases, and most importantly, they were all somewhat connected to someone who had been in China recently, or they had just come back from China, a couple of Chinese tourists. So there was this idea that we knew how to connect it back to the Wuhan epicenter. And then on the 21st, we had the first case that we couldn't find a connection back to China. And it's this patient 1, not even patient 0, we call it patient 1. And from then on, things in Lombardy and another region close by called Veneto, the numbers have skyrocketed. And these are the 2 regions where hospitals, they filled up the quickest, especially ICUs, really got hit hard by just how rapidly people were going into the hospitals. So as far as how does that make me feel, I think in some way Milan is one of the biggest cities in Italy with the highest amount of people traveling. Even though the first cases were not in Milan, they were in towns close to Milan. Realistically, that played an impact, the fact that Milan is so interconnected globally. And I would like to also point out a small thing. As you all know, soccer or football, so some people don't hate me, is huge in Europe, especially. And there was this one football match between a Spanish team and a team from close to Milan, another town called Bergamo, which some of you might have seen on the news. Bergamo was hit even harder than Milan. It was one of the first cities where you would see these, they had bodies that were being brought out of the city because they just didn't have enough space for them. So that city, Bergamo, is where this city is from. And so they think that one of the reasons why it spread so much was also because of this one football match where so many people from Spain and the north of Italy, they all met in that one stadium, and then they traveled back to their homes, and things spread out that way.
And Max, we're seeing some of that in the US too, where I'm sure you've seen that, where there's been some of the largest spreads have been traced to cases where there's been large number of people gathered. So that's a transition really to our next question that came from our audience is, from your perspective, what are you seeing in terms of how your news media in your country is portraying how the United States is dealing with the pandemic? Anybody want to comment on that? So we're wondering how somebody on the panel is wondering how the US is being portrayed in your country right now. What are you seeing on the news about us? Diana, do you want to jump in on that one?
Actually, I think the news in Hong Kong is just focus on the disease. US seems a little bit behind to lock down or to control. So that's why maybe the number of people infected is huge. But I believe all the government in the world, they really try doing their best. So I should say, actually, I don't know, but because Hong Kong, I really think it's different because we have experience of SARS. So, but yeah, for the US, they really they really don't know what exactly, and also maybe their lifestyle also not the same.
Good point.
Yeah.
Anybody else could have anything to add to that in terms of how your media in particular is portraying how the United States is dealing with the pandemic currently?
Well, as far as, I'm a bit biased. I also look at US newspapers, and I try to look at the news coming from the US.
Mm-hmm.
So I'm a bit biased in the sense that it's harder for me to answer as far as what Italians perceive what's happening in the US. But my impression is that the way it's being portrayed in Italy is that the US is now ramping up all the necessary precautions and all the limitations it needs to do. It's doing it. But again, going back to what Diana was saying, there's a bit of the feeling that the US was a bit late, in the sense that when things really started becoming very difficult to control in countries like Italy or Spain, the US had a bit of time to start preparing, and maybe some states did this better than others. Again, it's very difficult to compare, because since you have a massive country with a lot of states, a lot of people, it's very hard to say the US should have done something different. I think that's a very difficult statement to say. But I also see this in my country. Like, every region comes up with a different way of applying what the state is saying, what the government at a national level is saying. And I'm assuming you have something similar with governors and states in the US. It's very difficult to have a one country, one national approach that fits for all, especially when a country is as big as the United States.
Yeah, that's a great observation, Max. And I also want to acknowledge, panelists, that I know that what we're asking you is to speak on behalf of your whole country. Understand that that's a difficult thing to do, and appreciate that really what we're hearing and what we're asking for is your perspective. So I want to acknowledge that as well. So Jessica, with that acknowledgement, I have a question for you specifically. The question from one of our audience members is, what has the Chinese government done to assist people and businesses that have been hurt by public health response or by the pandemic?
As I may mention it before, so most businesses were closed probably during late January until probably early March. So what I've been heard, at least in Shanghai, so if it's a state-owned property, basically I think the state are waiving the fee for at least like 1 or 2 months. And if it's owned by a private owner, it's usually negotiable, and they can get subsidized by the state. So basically, they are waiving the rent for a lot of the business. As far as the countries, I think they are speeding up the other like factory approvals, so let the work back to work normally. So they're actually helping to ease the burden for a small business owner.
Got it. Thank you. So here's a question for all of you, and this is an interesting one, as they all have been. Is how do you think, or what's your observation around cultural practices in particular? And how do you think attitudes will be impacted as things open up again? I know, Jessica, you spoke a little bit about that, but any other thoughts about, as this continues to move on, how cultural practices and attitudes might be affected? Any thoughts about that?
Well, yeah, I mean, you start seeing the impact these days already. So when we go to the supermarket, people are try to stay as far away as possible from each other, but there's a lot of tension. I've been seeing people getting into silly arguments and discussions about, like, how far are you? Are we far enough? Please stay away. I think now people are very tense and tired, and they just can't find that peace of mind to really metabolize what's happening. But I'm an optimist in that sense. I think we're going to find a way to go back to normal slowly, step by step. And if that step by step means maybe less people in restaurants, or when people go out to bars and nightlife, there's going to be changes. But I think going back to your question, if people are going to change maybe culturally, let's say, I think most of you have seen what happened in Italy when everything got shut down. People singing from, out of their windows, and they try to organize, let's say, flash mobs, or at least, like at a time when people will get their guitar out and play for their neighbors. And I think that people will find other ways to express their cultural way of being. But I don't think that's going anywhere. I think we'll just.
Well, I think one of the interesting things has been, and I think you acknowledge this, reference this a little bit, Max, is seeing around the world how people have been finding ways to show gratitude for first responders. So that's something I think that's has brought people together as much as we can be in this time. Sort of as a follow-up question to the what is the impact around maybe some cultural practices and attitudes. Someone from the audience, this is the question is they write, in the US, we have a term called COVIDiot, for people who endanger others by crowding close to them in public without warning, etc. So what do COVIDiots do in the cultures you're in? Are you seeing some similar kinds of things? And you talked about that a little bit in terms of the grocery store thing, but are you seeing other ways that people are dealing with people that are not respecting that space piece? Anybody have any observations around that? Or that term?
I guess I will start. We didn't really have the term because actually we have a lot of regulations during the entire February and March. If you don't wear a mask, you're not allowed to go onto any public transportations or even enter any buildings. And basically, whenever people see you without a mask, police officer will come to arrest you or take you home, basically. So for us, it's more like a mandatory than you know, like a COVID. So, and also to some extreme cases, your neighbor will report you if they hear you cough a lot. But that was very extreme. But people are very nice. One of us, I want to add on to the question earlier mentioned before. I think before I moved to China, one of the things I didn't really like about it is we don't really respect social distancing. Like we like to gather together. So nowadays you will see people are actually, you know, keeping their distance from each other. You know, one of our work elevator in our office used to fit like 20 people. Now we are only take 6 people at a time, which is great. Like things are definitely changing in China, the culture attitude after the COVID-19.
Well, and Diana, you had referenced before that you could risk getting a ticket. So could you talk a little bit more about that in terms of what would lead to that happening?
Actually, because since like I think mid-March, more and more people come back from overseas, from Europe and the US. So we have like the second largest cases again is imported cases. So the government try to limit the gathering, a number of people like to 4. If they find like you have gathering more than 4 people, they will just give you a ticket, like a fixed amount ticket around like 300 US per ticket to each of the person.
300 US dollars per ticket?
Yes, to each of them. And they really mean it. They already issue many tickets already.
$300 does sound like they really mean it.
Yes. So since then, actually, like most of the people respect that, and it works, seems. So and in outside, I mean on the street, like we keep social distance. When we queue up in the elevator, we also keep social distance. So I think the concept and the culture already built up in Hong Kong. And we also know washing hand is the most important, apart from wearing a mask. And also the information we got to know about the COVID-19 is very transparent in Hong Kong, because the government will host a press conference every single day at 4:30 to report how many new cases and what their new finding regarding this coronavirus. So actually we have many information to decide how to cope with it. So I think it's okay in Hong Kong. Yeah, I feel.
Yeah, thank you for sharing that, Diana. We have actually in LA right now, Mayor Eric Garcetti, who's actually a graduate of the UCLA Lab School, does a press conference every day around 5, and it's been really incredibly helpful. So that I think that transparency and communication is something we've all come to rely upon. So one question that came up, there's 2 questions I want to do a quick follow-up on, very different. One is, Are you, each of you, hearing about perhaps about perhaps a second wave of COVID in your countries? Is that something that any of you are hearing about? Max?
Oh, yeah. Well, again, this is my point of view. This is what my understanding from what I've been reading, from what I've been hearing. A second wave, as in things now might be stabilizing a bit, but the cases might increase again later on during the year. I think most people expect that to happen. This is my understanding. I think people should realize that this might take a while to really stabilize. And when a second wave comes, we will be more prepared. But the fact that numbers might spike again, that could happen. Also because we all want to go back to what we were used to, traveling, people moving from one country to another. Some countries are going to be are going to have higher numbers than others as they decrease. So it's going to be difficult to find a balance, and then a second wave might come. But when my idea of what a second wave looks like, I think people should not think of it as reliving what we're living now. This first wave caught us completely off guard. If a second wave does come, as it probably will, I think it's going to look very different, and I think there's going to be more ICU beds. A lot of the patients that ended up unfortunately dying, in some cases they found themselves in a condition where there wasn't necessary safety net around them. And I think every country is working to make sure that that safety net is increased. And if a second wave does come, I don't think it's not going to look like the first one did. But that's just my point of view.
Thank you, Max. Diana, Jessica, are you hearing anything about a second wave?
Actually, the second wave already arrived in Hong Kong since mid-March.
Mm-hmm.
I mean, because many people studying abroad, like from the US, from Europe, they come back to Hong Kong. So, and during the last few days already stabilized the second wave. So we have only single-digit confirmed cases. But the government tell us we still need to pay attention. Cannot, because if we go out a lot, gathering a lot, it may have a third wave to come. Yeah, because it's really highly infectious. And also they warn us there are many no symptom patients outside. Means like maybe I look totally healthy, no symptom at all, but actually I carrying the virus and can infect other people. So that's why many Hong Kong people, we all together try to do our job. Apart from the government policy and the Hong Kong people also, we together to do something to fight for it. So I think hopefully it will be okay. Yeah.
Diana, have the schools reopened in Hong Kong?
No, since late January, no school already.
Jessica,
Yeah.
how about in Shanghai? Have the schools reopened?
Not yet. I think the 9th grade and 12th grade, which have to get into the university exams, they are gonna open probably late this month or maybe next month. But every other grades are still unannounced. We don't know when they're gonna reopen yet.
So another question that came in is, what advice would you have for individuals that are thinking about either traveling or moving to your country right now? Is that even possible?
I guess I will start. I think as of this point, I think if you are for a foreign passport holder, I don't think you will be allowed to enter China at this point. Even if you're Chinese passport holders, all the foreigner, any traveler from overseas countries, they have to do a mandatory quarantine for 14 days in an isolated location. So basically, the minute that you enter into the airport, basically they will test you for the virus and have you quarantine for 14 days at this point.
Max, any thoughts about Italy?
Yeah, I don't think it's an option right now.
Right.
In the sense that at least in the country, you are allowed to move for very few reasons. So obviously, any emergency is excused. And if you need to go back to your official residence, So, for example, a lot of people live in Milan, but they have kept their official residence, what they have written on their documents. They live in other parts of the country. Nobody's going to stop them from going back home. So all these kind of all these movements are allowed, and if you don't fall within this criteria, as both Diana and Jessica were saying, you can get fined. So we have the same issue. Tickets will get stopped. People will check, why are you moving? Why are you more than 250 meters away from your house? That's what initially I'd spoken about us being in a national lockdown. What that means is that you can move a bit for very few select reasons, and any of those reasons, besides obviously going to the hospital in very emergency cases, that needs to keep you close to your house. So if you're going for groceries and you're going a mile away for groceries, that's not okay. I'm sure there's a closer place for you to go do groceries than a mile away, but that applies to Italy. United States, you have bigger distances, so that maybe that doesn't apply. But yeah, no, I don't think anybody can just travel and just be a tourist right now and just come to Italy.
I have a bit of a follow-up question to that comes from actually one of our alumni board members, Coretta Harris. So welcome, Coretta. She says, the US president is anxious to open up the country, our country financially, to get people back to work. What is the government message about opening up the country and getting people back to work in your countries? I mean, Jessica, you've obviously you've talked about moving to that place already, right?
Yes. So basically, most of our workers are back to their jobs. I actually worked from home for about 3-4 weeks, and then we had to rotate shifts. So basically, all the workplaces are only allow 50% of normal people back to work. And currently, I think actually literally almost all my friends and like everyone I know that are back to work at their current capacity, back to very normal.
Mm-hmm. So a bit of a different question for you each, a little bit more personal, is what is the thing that you're looking forward to doing the most when lockdowns are lifted and you're free to move around or do whatever you'd like to do? What's the first thing you're going to do?
Yeah, I guess I can answer that first. So I'll be very cliche with my answer. So the 21st of February, we had the first patient.
I think we've lost Max a little bit. We'll come back to Max. Diana, what's the first thing you're going to do?
If it's safe, a gathering with friends, because long time no see. Also my mom, I didn't see her for a long time already physically. So I want to see my family, extended family, relative and friends all together, go to karaoke.
Yeah, karaoke. Well, we expect to see a video of that, Diana. So Max, I think you're back. We lost you. You talked about February 21st.
Yeah, well, no, I just wanted to say that, so in a couple of days, everything changed for us. And on the 23rd, so just a couple of days later, I was supposed to have a football match, and that got suspended. And they had kept postponing it a bit, and then eventually they just canceled everything, obviously. So yeah, that's something I'm really looking forward to, being able to go back to play football.
Jessica, how about you? What's that first thing?
Well, like I mentioned, things are a little bit back to normal. So I kind of see most of my friends like individually. So we didn't have any party more than 10 people, but I have seen some of them. So for me, when everything's really back to normal, I probably want to travel a little bit within China or maybe overseas. So that's the one thing I'm not so sure if I can still do it like, the first half of this year. So if that would be my thing to do.
So another question just came through about the topic of remote learning. And I think, Diana, you've talked a little about that with your son, and Max, you've talked about that's how you're engaging in your education right now. Any other things that you can share about how your countries are dealing with remote education? That's a question that just came through. Anything else to add to that?
Well, well, as far as Italy is concerned, one of the biggest issues initially was that there was at least a big chunk of the population that just didn't have the kind of access that allowed them to properly have an online education. So that was a very big thing, at least in the initial days, and the country really worked to get iPads or laptops, or get something to students in some of the parts of the country, and make sure that everybody has access to education. Because initially, one of the first things was to think, okay, well, this isn't that big of a deal. I can connect, I can do this, I can do that. And then sometimes you forget, like, there's a lot of people that can't. And yeah, at least here in Italy, that was a big issue, and the country moved to get as many people as possible connected and online, and get kids, get them their online education, physically have them arrive to them.
Yeah, thank you, Max. That's been a big topic here too, is, you know, making assumptions of what folks have access to, I think at all levels, and even work-wise. And one of the questions that also just came in is, do you have any observations or thoughts on, will the way that we've now moved to working and learning remotely, do you feel like that will have any kind of a permanent change or impact? Anybody have any thoughts on that?
I think since this time, because of our experience on using the, like, for example, the Google Classroom and using the Zoom for the internet classes, I think even after this, I think the school will use much more and more, I think, like an online class or online homework for us. I think they will more rely on this, apart from, like, parallel, apart from going to school physically, they will also try to use more that resources. So I think that's the trend, and also for the work as well. Yeah.
When Jessica, you had talked before about even going back to work, there's still some impact in the way that meetings are held. And one of the things that we've noticed here is that meetings have become shorter. So folks are wondering if that's going to be a long-term impact as well. So a question just came in about supplies and your access to having what you need. In the United States, a big topic has been does everybody have enough toilet paper? So one of our audience members is wondering, do you have enough toilet paper? And what have been some of the other supplies, if any, that have been those top of mind issues for your country? Anybody want to jump in on that one?
I guess I will speak for that. So we definitely have enough toilet paper. That was never one of our issues. But when the pandemic actually just happened, I think getting a mask is one of the biggest issues. Yeah. Because, like I mentioned, in China, you are required to wear a mask to go on the street. You know, in case you have to go out, you definitely need to have a mask. But at the time, actually, no mask was available because that was right before Chinese New Year. All the factory was closed to celebrate it. So I think some of the government and the factory actually just had a bus to pick up all the workers to go back to the country and then work on those masks. So as of right now, we have a good supply of masks. Everything is back to normal. We had enough supply of food, everything. But I think mask was actually definitely one of the issues back then.
Anybody else, Max or Diana, any supply items in high demand that you've not been able to have access to?
Oh, sure, please, Diana.
Okay. Actually, around like early Feb, we do have shortage of toilet paper, and also shortage of rice, but just for maybe 1-2 weeks only. But since then, currently everything back to normal. Like actually a huge supply of toilet paper, even on sale now, and also rice, bleach, detergent, everything stable supply. But just mask is with stable supply, but more expensive. And also we can't tell, like we go to the pharmacist, we don't know this brand is reliable or not. So that's my problem now, because they are selling different brand, but I don't know them. I'm not sure whether this mask is really up to that standard or not. So I think apart from that, everything is okay. yeah, in Hong Kong. Yeah.
Thank you, Diana. Max, a specific question has come in for you. Someone is wondering, when do you think the lockdown will end in Italy?
Well, that's actually a really interesting question. I wish there were someone else from Europe also here speaking with me, just because things have been so different from one country to another, even though we're so close and we're smaller countries. So I guess you would look at Europe as a whole in the same way you look at the US as a whole or China as a whole.
I was going to say that for us, in some ways, that's that similar conversation around different states.
Right. So I mean, as far as Italy specifically is concerned, what we've been told is, let's see how these couple weeks go, the next couple weeks, and let's talk about it after the first couple of days of May. So the way it's been working in Italy is that the prime minister will come out and essentially say, this is how things are looking now. This is how we're going to start behaving tomorrow. And we'll do this until I give you further communications. So the next time we'll get news from the government as far as how to behave and what's going to change, it's going to be on the 4th of May. And we're hopefully, if the numbers follow the trend they've been following, the past 10 days have been relatively good. I mean, they've been stable and pointing downwards. If that continues, then hopefully on the 4th of May, something is going to start opening up again. But as far as when will the lockdown end, if another way of reading, of interpreting that question is, when do you think your life is going to go back to normal? I'd rather not answer. Let's put it that way. I think it's gonna take a while. But if you look at other countries like Spain, Germany, England, France, everybody's taking slightly different steps. Even in Northern Europe, Denmark, Sweden, everybody's tweaking it a bit and trying to adapt and apply specific precautions depending on what their country is looking like in that moment. So schools are opening up again. Schools are going to open up in France and Germany, I think, somewhat soon. Whereas in Italy, we haven't really been, there hasn't been a talk about that yet.
A couple of questions have come in around how governments are messaging the pandemic. You know, for example, the focus on the number of cases and those who have passed versus what the government is doing to get through this. How do you feel your governments have balanced the messaging around the pandemic? Any thoughts on that? Go ahead, Diana.
Yeah, I think for Hong Kong, we are quite lucky because I think the government really doing a good job. So as I mentioned before, every day they have a press conference. So all the doctor will be in the press conference, tell us how many cases more yesterday, and what's the relationship they find on those cases, and also any new finding from their research they find regarding this virus. And so we know more, and we feel just more safe and being informed on everything. And also the government seems their policy is sometimes they tightening it if they see the trend is more dangerous, maybe more cases is coming up, they will tighten the policy. But once they see the situation change a bit, maybe for 2 weeks, then maybe they will try to loosen a bit. So they keep changing the policy, but according to the situation. So I think it's pretty good for Hong Kong people. Yeah.
Thank you, Diana. And I want to thank each of our panelists. I can't believe we're coming to the end of our time. And I want to acknowledge that you know, we've put you in a challenging position in terms of the kinds of questions that have come up and the perspectives that we've asked you to provide for us, but so very grateful for your honesty and for your candor. And there's so many more questions out there that we're probably going to do this again. And Max, hear your feedback and wanting to have some broader representation, but appreciate the perspective that you've provided. And I want to thank each of you and hope that you each continue to be safe and well, and that it won't be too long again before we're all together in the same room. I would absolutely love that. And to all of our alumni that are out there listening, one of the things that's important, ever more so now than ever, is the sense of Bruin community that we have, because that's what Bruins do. As our panelists have done today, We share with one another, we support one another, and now particularly in this economy, we look for ways to open for doors for one another. So we will continue to look for ways to bring us together, to have conversations like this, and to build strong and uplift our community, because that's who we are. We're Bruins, and we're Bruins strong. So thank you for being with us today. This will be posted on our YouTube channel. We'll get that out to you and also let you know what's next. And finally, if you have any ideas about topics or things that you'd like to see in future conversations, please let us know. And with that, thank our panelists, and go Bruins. Thank you.